Hi, this is Dr. Nick. I'm the Incrementalist. I'm here at Health Datapalooza, and I'm here with Anil, who is just on stage talking about his personal story. Anil, thanks for joining me today.
I appreciate the invitation.
So tell us a little bit about your story and what you shared on stage, if you would.
Sure. On stage, there were a number of talks from patients, how they use their data. I'm a caregiver for a patient. It happens to be my little sister, Tanya, who was originally diagnosed with late-stage metastatic breast cancer. She passed away recently, but before she did, I appreciate that. Before she did, she used a personal health record that happened to be where her brother was working at the time, a company called Gliimpse in Silicon Valley. Apple later acquired Gliimpse for its health records business and then used the people and some of the technology to release their health records that some of us have heard about in the public press. How Tanya used her own records under her care was that in the last year of life, she was seen by 17 facilities, and she had the ability to collect them all into her Gliimpse. Her Gliimpse was a little like your LinkedIn profile, which is a history of approximately what you've done and where you've been. This was a history of her healthcare. So she would show up at a new facility and share this glimpse into her past, and they could easily assess what's been going on. The other thing she was able to do is donate a copy of her glimpse to a nonprofit, a cancer nonprofit. Another good story is Epic, the EHR that was used where she was being treated at the time, which is UCSF in San Francisco. Epic just crashed. It crashed hard for 36 hours. They couldn't bring it back up. And the oncology department canceled many, if not most, of their visits, except one. Yeah, she had her own data. It was fresh from her labs from yesterday. And so for 45 minutes, her oncologist and her just had a exchange without missing a beat.
So not that that's the only reason for patients to have their own data, but it's a really good reason. And one of the things that I heard that really resonated with me was the pushback we get repeatedly from the medical profession. I don't know what patients would do with this data. And as one of your co-presenters said, that's exactly right. You don't.
That's right.
And here's a given story of genuine use.
Yes, that's right.
Not only personally, but also for additional benefit and additional opportunity. If you think back to the journey, was there anything that sort of stood out as to that inflection point that made you, your sister, or your family realize of the importance of this?
Yeah, it was the complexity of care, because she was not being seen by one facility that had the majority of her records and her imaging and her genomics. So chronic care is a journey that's across both time and geography. And people are trying all kinds of things like Chinese medicine and acupuncture and homeopathy because it's chronic. It's not acute. If it was acute, we would have a pillar procedure and it'd be done. But because it's chronic, we don't know what's going on with the particular illness in the body. It's important that patients be able to collect, organize, and share their information, especially with something that is as difficult as late-stage metastatic cancer.
So even though this is a specific example, what I would say is that incremental step, an incremental learning point, which is this is complex, it's a team effort, I think that applies to so much more than complex chronic conditions. So the reality is that incremental step is the realization that you need to access that data, gather it, and make that part of your record.
That's right. A lot of people are talking about this one small change, this one incremental change, sharing and mediating information through the patient, recognizing they're the greatest stakeholder and the most underutilized resource. People have been talking about it, but a small little shift in thinking produces great results.
As I always say, there is no other person in the room that has a bigger vested interest in the successful outcome than the patient, bar anybody, physician, relatives, whatever. So, Anil, thanks very much for joining me.
I appreciate it. Thanks for having me.
I'm Dr. Nick. I'm the Incrementalist. Don't let perfection stand in the way of progress.